Hi, my name is Sam Henriquez,
And my name is Kaylee Kempfer.
and today we'll be presenting on hyperbaric oxygen therapy and the effects that it has on post-concussion syndrome. So to start off, why is this significant? This is significant because mild traumatic brain injuries, also referred to as concussions, are a very common head injury. Globally, in 2017, there were approximately 10 million reported cases of TBIs. 1.7 to 3.8 million of these were in the United States alone. It was also reported that post-concussion syndrome occurred in 10 to 20% of these patients due to structural and metabolic brain changes. Symptoms of post-concussion syndrome include dizziness, imbalance, changes in sleep patterns, neuropsychiatric symptoms such as behavioral and mood changes, and cognitive impairments. The combination of all these symptoms can be debilitating for patients, so we decided to study hyperbaric oxygen therapy to determine if it would be a good treatment option to improve these symptoms in these patients.
So, studies found that there were improvement in symptoms when patients received therapy 3 to 5 times a week for 30 to 40 minute intervals with the chamber at least 150 kilopascals, which is the pressure inside the chamber. And this therapy was done for at least 2 months. And so they measured these changes through different tests like cognitive and motor function tests, neurotract tests, and MRIs. And these were done before and after treatment to see how much had changed. And so some effects that the hyperbaric oxygen therapy had on brain structure was that there were increases in cerebral blood flow to multiple parts of the brain. There was decrease in neuroinflammation through an increase of the anti-inflammatory cytokines, and there was an increase in fiber density and myelination of white matter. And so there was also statistically significant improvement in motor and cognitive functions because of this increase in brain perfusion, and there was also a decrease in symptoms that they were experiencing. And so just some recommendations that we had for further studies was just to increase the sample size done in these studies to increase accuracy and the significance of the studies, and also to have more diverse samples used, just because these studies focused a lot on the military, but we also thought it would be good for these studies to include athletic injuries, just because that is so common in the United States today.
So for nursing implications for hyperbaric oxygen therapy to treat post-concussion syndrome, nurses should be aware of adverse effects. The main adverse effects of this therapy is barotrauma, which is injury due to pressure changes, and also oxygen toxicity, which can occur due to the high amount of oxygen that these patients are receiving over a long period of time. Nursing care for these patients experiencing this treatment, the big one that nurses should focus on is to reduce procedure anxiety. Patients receiving this therapy are in a compact chamber for a long period of time. So this can cause claustrophobia and anxiety. So nurses want to pre-medicate for anxiety as well as pain and nausea, and then also manage medication during treatment, including IV fluids, IV medications, and if needed, blood products. Additionally, nurses should regulate temperature to prevent seizures in these patients and advocate for patient safety, such as removing jewelry, removing choking hazards, and ensuring patients do not have static producing clothing. Our references are listed on the bottom of our poster. Additionally, if you would like to get in contact with us or have any further questions, our contact information is listed on our handout.